Well, let's hear from Dr. Wanny Scott McDonald. She's head in GFK. HEARTT has been here with you for some time now. I'm really interested in the impact they're making.
HEARTT has made a significant impact in not only improving our services, but having the services available at a higher level. When we first opened our doors, we had a shortage of physicians, but we didn't have physicians in many of the areas. Let me actually tell you a key area. I mean, if we look at orthopedic, we know we have the highest number of trauma cases in Liberia from other accidents and the Pempen riders. Through HEARTT in 2008, we were able to open just a ward for accidents or trauma unit, and that unit is staffed primarily with HEARTT physicians. We're lucky today in Liberia to have a renowned young orthopedic surgeon who is based around the clock, Dr. Bird, who volunteered through HEARTT to come and be with us for about a year and has been doing a lot of phenomenal surgeries. Things that folks will have to be flown out of here for, or even if they will be losing limbs, he's been able to operate and save that. Then we have a real good, robust emergency department, and all the physicians that staff there and see our patients are the HEARTT physicians. Like Dr. Salif said, we've been able through HEARTT now, collaborating with a couple of universities and key medical centers in the States, to have physicians on the ground rotating all the time. And what we're trying to do right now, and that's one of his purpose for being here, is to branch off to the other areas. We need to have obstetricians and gynecologists, and we're trying to branch off and start bringing residents and physicians in that area. One of the team he just brought on the ground is a retired obstetrician and gynecologist, and we're looking at the needs. And the emphasis, like you say, is training, is sustainability. At the end of the day, when we're through with JFK, we want to make sure that our young physicians, our young nurses are trained and they have specialized in the various areas. I mean, we all know what the mandate of JFK is. We are teaching referral center.
Some of the HEARTT physicians are in at GFK for like a year. Is that enough time to train somebody in this field to take over when they leave?
That's why we've set up a rotating program, and we've got curriculums now that we're developing. One of the beauty of the program is before anyone leaves the residence, someone comes in for at least 2-4 weeks and then they turn it over. So there's a lot of continuity, and like you said, Dr. Salif said, the idea is sustainability. But the main thing is that because the program is growing so well now, that we see a lot of our young interns, our residents, and medical students who are really beginning to get an interest in various fields of medicine, because they have someone that can help mentor them and someone who they can really follow and learn the clinical skills from. So it's really working out well. And then you just cannot tap or put dollars and cents on the services they provide. Without the services, we really won't be able to serve the population. We started real small at JFK. Last month we saw 13,475 patients in our OPD. That's a lot of patients that we're serving right now. Our pediatric population has grown by leaps and bounds because, as you know, we're treating children under 5. So, the folks are coming, and we're very glad that JFK can provide the services. But we're also glad that HEARTT is here to help embrace what we're doing and provide the expertise on a rotational basis for our people.
This pediatrician brought in by HEARTT, how can he help to boost your own healthcare delivery to children?
Well, like Dr. Salif said, he's a pediatrician. So we're happy that now, after 4 years of taking on JFK, we now have someone who's a pediatrician. He has strong ties to Columbia University. He comes as a specialist. He will not only help us put in a curriculum, but while he's here, we hope he can begin to train and mentor some of our young doctors who have an interest in pediatrics. We hope that with his presence, we'll be able to develop a more sustainable curriculum I understand today that he had already gone and spoken with the dean of the medical school. So that's the type of collaboration we want, and that's what we want to develop, because that's one of the mandates of JFK, to train. We don't just want to provide services, but we want to make sure that in the process we're training young doctors who will walk the walk and be able to take care of our
So are you envisioning, after the training, these doctors being certified as specialized in several areas?
Well, I think it will depend on the curriculum, but the main thing is that these doctors are now helping to the young physicians to develop interests or burning desires in the various fields, and to expose the various fields of medicine to them. So a lot of it will also depend on the physicians, the older physicians, and what's put in place. But in the long run, we hope that we have sustainable programs, and we will develop residency programs here at GFK.
Okay, thank you, Dr. McDonald. I think we can go.